So it's good?
Well, you tell me. How's it look?
You need to come a little closer, actually.
That's always the case.
Perfect. That's the way. You guys are good.
All right.
You guys comfortable?
I'm always comfortable. Yeah.
Let's see if I can get a little closer. Okay. We're rolling.
Hey guys, we are here at the Ritz-Carlton in Laguna Niguel at the ARTAS user meeting, and one of the main faculty members, Dr. Bauman, is here with me. I think you want to give a little recap of what happened today.
So I just started using the robot, as you know. So there are a lot of people here who have a lot more experience. First of all, it's exciting to be here. Thank you to the ARTAS people for inviting us to come and also to present. What I presented was why we added the ARTAS hair transplant robot to the practice, and I think it was very well received. But probably more important than that, I was humbled by the presentations that I saw. Those people who kind of come before, and
what about my presentation?
Okay, I was getting to that. So, yes, so we saw a lot of scientific presentations about how to use the robot better, and of course that was excellent. It's great to see other physicians sharing. And of course, Spencer, your presentation on the psychology of the hair loss patient was phenomenal.
That's what
I didn't expect anything less.
Well, you're not going to find that at the ISHRS conference.
That is true. Yeah. How many times have you been invited to speak at the ISHRS?
I have never been invited to speak at the ISHRS conference.
Yeah, I don't understand why.
20 years. Yeah.
You know, world-renowned author, talk show host.
Well, you know what it is? I think they are afraid of the truth, unfortunately, and they shouldn't be, because if everyone was able to, you know, kind of be privy to the information that I am, it would make the entire field so much better, and everyone's life so much easier.
For sure. I mean, every time I listen, I gain some knowledge about the psychology of a hair loss patient, you know, and I think the physicians here who were in the audience during your presentation could appreciate that.
There's only one guy twitching, but otherwise I think everyone else.
So 99%.
Well.
Okay, so I think it was very well received. It was very good.
Your talk was great.
Oh, well, thanks so much.
Yeah, let people know
what you like
talking about. Well, I liked your visuals were unbelievable.
Okay.
You know, and you gave me some good tips about maybe adding. I don't bring slides. They said that's not what I do. But next time, I think I'm going to give you a call and say, Alan, you can put something together for me. But I like the fact that, you know, I mean, you're new to the whole, you know, technology, but you jumped in feet first after you did your research.
For sure.
And I think a lot of people. They don't do as much research about the new technologies as you do. So you took, you know, 3 or 4 years or 5 years
absolutely
to jump in, and I think that's pretty important.
Yeah, so I come in with a little bit of different perspective because I had already been doing FUE.
Right.
My team, myself, we've already transplanted close to 2 million grafts before we got the ARTAS hair transplant system. So we have a different perspective. We didn't convert the practice from linear harvesting. We already did FUE.
We've been doing FUE since like 2002 or 2001.
Yeah, I think the first time I tried it was in 1999.
Yeah.
You know, and it was soon after our discussion.
I think we had a phone call. I was like, "Listen, this Woods guy is onto something."
Yes.
Yeah.
Yes. So that was one of the main factors early on.
Yeah.
You know, we've seen patients going overseas to have that kind of procedure done in the 1990s. We're like, why can't we learn that stuff?
Absolutely.
You know, I'm a trained microsurgeon.
Yeah.
But it took us a couple of years to figure it out.
Yeah, but even Bill Rasmussen and Bob Bernstein, they were like, "You're crazy, this will never work." 6 months later, they wrote the first paper. And I'm glad that they did that, because that inspired guys like you to move forward, and everyone was taking it seriously.
I think it was Bill Rasmussen who presented in New York, kind of unveiling the Fox technique and so forth.
Yeah.
And that same year, I had a poster presentation on the FUE.
Right.
Harvesting and implantation for somebody who wore a hairpiece. So it was a small case, traction alopecia.
Yeah.
And, you know, but that's the history. You know, now look back 15 years later.
Well, I mean, this is the world. No new hair transplant surgeon is considering strip. Now, you know how I feel about strip. I still think there's a place for strip, but no one's asking about strip. No one contacts the American Hair Loss Association or the IHRS, and they're not like, where do I get the best strip procedure? It's all FUE. It's either ARTAS or NeoGraft.
Well, and it makes sense, right? So why wouldn't someone want a procedure that has much less scarring, much more comfortable, no restrictions in terms of hairstyling afterwards, you know, that has just as good results-wise, naturalness and such as a traditional procedure. I mean, it's like no one's signing up to get their gallbladder out through an 8-inch long incision, right? They're going to want it through their belly button. Yeah. And I learned that in my general surgery residency.
Absolutely, that's a really good point. And I think everyone, you know, I mean, to the consumer it's really palatable, but for some reason to the doctor, I mean, these guys are so resistant, and they're being left behind. You know, I like I said at the, you know, during the conference, I mean, there's the past and there's the future, and the guys who are resistant are going to be part of the past.
That's absolutely true. We've seen that through the ISHRS.
Yeah.
Part of what I tried to explain to my colleagues is a little bit about how we investigated the ARTAS procedure so that they would get a little bit of an idea that it's not just all about, you know, bright, shiny things, what's new, what's latest and greatest, but what really works and what's going to work well in our practice, you know, in a patient-centered practice like Bauman.
Yeah, and I think that's actually a really good point, because there are new guys who do just, they purchase the ARTAS purely for marketing reasons. They let it collect dust. And that's not only, I mean, I kind of understand it as far as, you know, they want to say that they have the latest and greatest, but start to utilize it, because in time, you're not going to be able to reconcile talking these patients out of having the ARTAS procedure.
Oh, yeah, well, yeah, especially if they're converting into something else other than FUE, that's a big problem.
Like
Huge
strip,
problem.
which is happening every single day. Okay. I talked about the bait and switch situation. Our complaints have grown exponentially through all of our resources about the bait and switch.
It's terrible to hear, obviously. You know, but you know, unfortunately, then you're going to have people in the industry doing that.
So,
you know? But the newest, latest, and greatest, obviously, is going to be a physician who has the command of all the different styles of minimally invasive harvesting, whether it may be some manual harvesting, you know, combined with robotic, and then of course all the new technology that's coming from the robot, whether it's recipient site creation, or just around the corner we have graft insertion, and all of that is under my control. So I can build that, you know, almost like a 3D CAD drawing, and translate the artistry right into the computer, and then boom, have artists go ahead and do that work.
But the one thing I think is important for our listeners and our viewers to know is that it's not just a turnkey solution. You got to know what you're doing with this robot. You know, a guy like you has a tremendous amount of experience, understands how to set the correct parameters.
Absolutely.
But the guy next door who may just have been doing cosmetic surgery, or he's an ENT, gets a robot, it's going to be a totally different game. So I think that's important for consumers to understand.
Yeah, absolutely. You know, having the experience of doing manual harvesting, whether it's 1 million or 2 million grafts, and then moving into robotics, I mean, it gives us a huge edge.
Yeah.
Huge. You know, and bringing the artistry to the process, that it's not just the technology. You can't have one without the other. You have to have the technology plus the artistry and clinical judgment.
Well, I'm hoping that the company, and I think they are moving in this direction, are going to really start training their new customers to really learn how to do hair transplantation the right way. It's kind of been a little bit of a hurdle. And I'm not saying for the company, but for the new users. But eventually, they're going to spend $250,000 for this robot, and they're not going to be able to compete with guys like you.
That's very true.
I think that's good, right?
Thank you, guys. Looks great.
Yeah.